I'm so excited to have you here as our guest today. We've been looking forward to this talk for a while, this conversation. Today we have Tiffany Eitreim. She's a doctor of physical therapy and she specializes in pelvic floor issues. She works at the Arizona Center for Chronic Pelvic Pain. Can you tell us a little bit, Tiffany, about your specialty and what you do there?
Sure. As a physical therapist, most people are familiar with working with the musculoskeletal system. So I do that, but just specifically related to the pelvis, which to be a good pelvic floor therapist, you do have to be good at treating the whole body, but that's typically where I start. At this practice, I tend to see mostly pelvic pain conditions or nerve conditions where you're seeing numbness, tingling, things like that. But I also have treated a lot of urinary incontinence, constipation, things like that.
Mhm. Yeah, and so obviously my practice is focused in gut health. So my initial interest in talking with you is especially related to those people with gut issues, especially constipation, right? Is that where you would see the
Mhm.
most crossover with gut?
I would say absolutely. I tend to see more constipation in general, especially in my field with tight pelvic floor muscles preventing exit of stool.
Hmm. So when people ask me that, there's various different factors to consider. So first of all, definitely different foods can cause stomach pain, but it's extremely frustrating when you drink water and you have stomach pain. And this is an important topic because the more you understand it, the more then you can implement strategies to minimize that. And I don't want people getting to the point where you feel like you can't eat or drink anything. So that's really what we want to get across, that if it's happening, there's a reason and there are things
Mhm.
you can do about it. So one of the reasons that that can happen is water can be too cold. So when you drink cold water, it actually constricts your blood vessels and that can affect the intestinal muscle or the stomach or intestinal muscle contractions, and that can cause pain from muscle contractions. So we produce digestive enzymes, and they need to be a certain temperature, and they also need certain acidity level to activate. If we're drinking a lot of cold water, that can lower the temperature in the digestive tract. It can slow down enzyme activity, and that can cause symptoms like bloating, which can lead to discomfort. And then both the restricted blood flow and the decreased enzyme activity can lead to a delay in how quickly your stomach empties. And that can also cause feelings of fullness and discomfort. So the temperature is one thing to consider, and definitely drinking room temperature water is what I would recommend in general, but especially if you're experiencing pain when you drink water, because the room temperature water will calm down the muscles. It'll create an environment where the enzymes can activate more optimally. It improves blood flow, which improves overall digestive function. So the temperature is one piece of it. You had brought up an interesting point when we were talking earlier about maybe flavored water. Did you want to talk about that?
Working with a lot of like bladder issues or pain issues, I have a lot of people that tell me, well, I drink a lot of water or I drink only water. And I really have to investigate
Hmm.
if that's as clear as they're explaining, because I've gotten burned multiple times that people are drinking carbonated or flavored water because they think it's the same thing when it's not. Or with certain flavorings, I've had a gal in the past that was doing some sort of electrolyte powder that had additional acid in it because it was a citrus flavor.
Hmm.
And that can be really irritating for the bladder and can generally increase pain. So I always try to clarify with patients, like, well, okay, so you're drinking water, but is it like plain water? And
Mm-hmm.
then I also typically ask, is it cold or room temperature if they have a preference, things like that.
Mm-hmm.
So, yeah,
Yeah.
I think it's important to at least clarify so that people aren't putting other substances that can cause irritation in their systems.
Yeah, absolutely. So not all water is created equal. And then the
Correct.
bubbly water can create more gas in the stomachs, and then that can
Absolutely.
contribute to that bloating and discomfort
Yes,
associated from bloating. Yeah,
definitely.
and acidity actually stimulates gastric acid secretion, so that can be an issue. Another thing is if people have acid reflux or GERD and they experience pain when they're drinking water, it could be what you said, maybe they're drinking a flavored water. So many of those products have citric acid in them, which is
Yep.
not in itself harmful, but it can contribute to acidity, especially on an empty stomach. It can either contribute to acid reflux, which can feel like pain close to that area. A lot of people with acid reflux also have a thinned out mucus layer. We naturally have a mucus coating protecting our stomach, and that can be just thinner than it's supposed to be, and that can cause more irritation, especially if you have acidity on an empty stomach. So that's something that I recommend people with acid reflux. I always recommend drink most of your fluids between meals, and so that you're not, for one, adding, and so this would be true whether it's flavored water or regular water, but you're
Mhm.
not adding to that pressure that can drive the stomach contents up into the esophagus and trigger that pain. And then the next thing is how fast you drink water. So if you're drinking really rapidly, drinking water fast, it can actually stretch the stomach beyond the capacity that it's used to and cause a buildup of pressure that can stimulate a hypersensitivity where the nerves feel more pain than maybe they normally would or should from that. It could also maybe put pressure on some of the surrounding organs or tissues. So,
I wanted to mention in
mhm,
regards to drinking speed and volume, I
mhm,
think that that can also be really important for bladder function. I was thinking in Arizona, with it being really hot, I have a lot of patients that guzzle their water because they're so hot and they're so thirsty. And that creates that quick distension of the bladder also, which tends to contribute to frequency and urgency.
mhm. Yeah, that's so interesting. So I think our recommendation for that would be don't wait till you get so thirsty, right?
Correct. Yes, drink slowly and consistently over the course of the day, whether
Mhm.
you're feeling thirsty or not, to make sure that your body is well hydrated.
Yeah, stay ahead of it. 'Cause so let's just say you need 64 ounces of water in the day, which is kind of an average recommendation. I tell people you should drink 32 of those ounces before lunchtime because that's half of your
Mhm,
day.
mhm.
So you really want to pace yourself and not get to the point where you're so thirsty that you're chugging your water for sure. And then
Absolutely.
also the hypersensitivity, this can come into play, especially with people with IBS. It's very common to have an increased visceral hypersensitivity where the nerves of your intestines are actually they're hypersensitive. So what should feel maybe like minor bloating or pressure actually feels like significant pain. So that could be another thing that's going on if you do have IBS and you're noticing this problem.
Mhm. Absolutely. I see that often with that kind of idea of visceral hypersensitivity, where, for instance, with the stomach in this case, how you have the layers of muscle that are supposed to stretch and have tension to them, but our brain interprets the signals of stretch incorrectly as pain when instead it should just be that stretching distension sensation, not necessarily a bothersome sensation.
Mm-hmm. Yeah, exactly. So, yeah, I've had clients describe, I'm sure you have too, describe like tremendous pain. They think something's seriously wrong, and it could just be from that gaseous bloating, that distension
Mhm.
that's causing that pain. Even going
Absolutely.
to the ER sort of pain, but it's that visceral hypersensitivity. So as far as water goes, I would say drinking water, again, most of it between meals. So I mentioned that with acid reflux, but just even in general, because water does, any fluid you drink with your meals, it's diluting your digestive secretions. So in general, you want to do that, but it'll help, for example, with IBS, if you drink a lot of fluid with meals, it can, and you have, say, some food intolerances, it can enhance the effects of those food intolerances and make them a little bit worse. So in general, drinking between meals and drinking continuously throughout the day, keeping your water at room temperature, and then maybe being aware of your posture as well would be
Mhm.
important.
Agreed.
Um, yeah, because if you're hunched over, you don't have good posture, that can also cause stomach discomfort. It can cause pressure, could cause
Mhm.
reflux.
Mhm.
I sometimes recommend relaxation breathing techniques as well. One of the easiest things to do. So this is if you feel like that you can do this before meals to promote digestion. If this is happening when you drink water, you could also try it before drinking water and see if it helps, but just breathing it, taking slow, deep breaths for a couple of minutes. So breathing in for 4 seconds, holding it for 4 seconds, and breathing out for 4 seconds.
Mhm. I tend to encourage people to breathe for the same amount of time and also to breathe for relaxation. I tend to focus on belly breathing, where people are breathing in and breathing into the abdomen, especially with issues like bloating. A lot of times there can be issues with the pressure between the upper abdomen with the lungs and then the lower abdomen with the organs, which is sometimes exacerbated because of tightness of the pelvic floor. But to better manage those pressures, breathing into the abdomen and breathing into the belly will be helpful for better regulating those pressures.
Yeah, yeah, that's a really good tip about the belly breathing, because I think a lot of people breathe shallow, right? Take
Hmm.
shallow breath.
Absolutely.
Hmm.
Yep. A lot of like chest only expansion when actually the diaphragm is much more efficient when it's pulled down, and therefore you have expansion into the belly.
Yeah, yeah, I love that. That's super important. So if you haven't tried that before, think about actually breathing, imagine breathing into the belly and feel that belly
Mhm.
expanding.